This study now shows that stimulant medications affect arousal and reward. And we'll see what reward means. Reward is about the ability to, in a way, task persistence. So stimulant medications affect arousal. We know they enhance noradrenergic tone, dopaminergic tone. They increase the levels of noradrenaline dopamine within the synaptic cleft. We know that amphetamine-like stimulants, dexamphetamine, lisdexamphetamine, release dopamine as well. So they drive the brain organization towards a more wakeful and rewarded configuration, improving task effort and persistence without effects on attention network. So here's the really interesting part that I want to highlight. Matters for clinical practice. What stimulants do is they increase the significance of stimuli. So if for an individual work's important, it will increase the significance of what they need to do in work. And because they change the relationship between cues and the actual reward, which is where the reward is, dopamine is moved towards the cue, so they're able to stay on that task longer, right? Focus longer. So what we see as attention improved, focus improved, is actually a result of the significance of the stimulus increasing. Here's the catch, is that we don't always get to choose what stimulus is important for the individual. If productivity is important for the individual because it fulfills their self-esteem, then the significance of those unmet needs and the productivity aspects magnifies as well. Similarly, if we have an individual that has an adaptive environment where they're optimally balanced pre-morbidly in a way, then the stimulant is going to allow them for that optimal balance because they have a balanced appraisal where work's important, family's important, kids important, taking rest is important, sleep's important, etc. Right? So the significance is spread across stimuli, environment, and internal well-being. But the catch is if an individual's stimuli from the past have been, for example, video games, or obtaining relief through substances, or obtaining relief through what we may consider maladaptive aspects, or where tasks have been difficult because of a heightened threat prediction, anxiety, then stimulants will only increase the significance of that stimulus. It does not automatically guarantee the task will be completed. This is where the actual assessment matters. The question one, clarify the predictions, the developmental aspects. How were they operating? What was their operational mode pre-morbidly, or their patterns? Because what stimulants are going to do is enhance the significance and thereby keep the persistence on that.